Hello, welcome back in Pharma Training Solutions. So I will be discussing briefly what are NSAIDs, agents which are used in the gout, and those which are used in rheumatoid arthritis. Of course, all these are inflammatory conditions. Now, let me briefly define what is inflammation. Now, inflammation is a response triggered by damage to living tissues. Of course, the symptoms include redness, fever, tumor. Here, of course, we are meaning swelling. We can also have pain. And of course, sometimes there could be loss of function. However, there can be exaggerated inflammatory reaction, what we call the hypersensitivity reaction. Now, which are those chemical mediators for inflammation? One is histamine. Of course, we know it is stored in basophils and mast cells. Prostaglandins or the eicosamides, synthesized from arachidonic acid. These are the examples: PEG2, thromboxane, and prostacyclin 2. Leukotrienes shall refer to them mostly when we are in asthma. Bradykinins, platelet activating factor, and different cytokines such as TNF, tumor necrosis factor, and interleukins. Now, inflammation, of course, is due to mostly the local hormones, what we call the autocoids. Now, because most of the inflammatory mediators are autocoids. So what are autocoids? Now, autocoids are local hormones in immediate proximity to their site of action. Now, they are produced, these are hormones which are produced near their site of action, locally produced or locally expressed hormone. Of course, the examples are those ones above: histamine, bradykinin, serotonin, eicosamides, where we have prostaglandins and leukotrienes, and of course the tumor necrosis, platelet activating factor, and of course very many others. So ensure at least you know how to define what are autocoids. You can get maybe other definitions in case you have them. Let us look at eicosamides and the biosynthesis. Now, this is just a brief description, but I'm sure for you have the cycle itself, or the diagrammatic representation, where we have that eicosamides are not stored but are released due to stimuli, and arachidonic acid is, of course, is released from the membrane phospholipids by what? By the enzyme phospholipase A2, and of course this one forms the basis for the synthesis of these prostaglandins. Now, remember, for me, I've not explained what happens in details. My goal will be just talk about those enzymes, but I'm sure for you have the systematic flow, the systematic one from phospholipids to arachidonic acid and prostaglandins, phospholipase A2. Now, of course, this one's where we get the prostaglandins. Of course, this is synthesized via the cyclooxygenase pathway by the cyclooxygenase enzyme. Of course, we know that it has two isocymes, COX1 and COX2. So I know where each one is expressed. What are those examples of prostaglandins? We have E2, F2, F2 alpha, and D2. We also have the thromboxane and the prostacyclin. Now, we have to know the effects of these prostaglandins before we talk about the drugs which mimic the prostaglandins, and then before again we talk about the NSAIDs. Now, which are those effects of the prostaglandins? Of course, we know that thromboxane 2 is a potent vasoconstrictor and it increases platelet leukocyte interaction. That's why this one, in the heart diseases, it can cause cardiac events. Now, prostaglandins E2 can cause vasoconstriction. F2, it maintains the ductus arteriosus patent until birth or when we are going to give surgery. We have the E2 and the I2. These, of course, are responsible for the mucus secretion or the cytoprotection. Then we have the E2 again and F2 alpha, this one increases uterine contraction and used in induction of labor. Of course, we are going to look at the drug. We also have the, of course, prostaglandins in general. They increase sensitivity to nociceptors and can potentiate pain perception. And of course, there are very many others. Now, which are those analogues for these prostaglandins, or which inhibit them? Now, aspirin in low doses, it is used as a cardiac protection, because we have said that prostaglandins can increase platelet aggregation, and once this platelet aggregation, remember, maybe you can form thrombi, and this thrombi can increase these cardiac diseases. Yes, so of course we know misoprostol, an IE2 analog, is used in prevention of NSAID induced gastric ulcer. Now, of course, again, misoprostol is an analog of E, and F2 alpha is an agonist used in induction of labor. As we are saying, these prostaglandins are used in induction of, they have effect in induction of labor. Now, also it is used, we have other drugs like apostadil, which is an E1 analog. It's used to maintain ductus arteriosus open in some neonates with congenital heart condition awaiting surgery. Again, aprostadil is available in pharmacy for management of erectile dysfunction. I hope you know it. It's given, I think, intrapenile, intra-IM, I don't know. But it is also available in pharmacies. Latanoprost, used in glaucoma. Bimatoprost, used in ocular hypertensive. All these are analogues for prostaglandins, because based on the effects. Let us look at now NSAID. Of course, we know NSAID. I will briefly explain the mechanism of action. They inhibit the prostaglandin synthesis via the COX. Because we have non-selective COX inhibitors. The prototype is aspirin. Others have ibuprofen, aceclofenac, diclofenac, ketoprofen, naproxen, indocin, indomethacin, meloxicam, piroxicam, mefenamic acid, diflunisal, etodolac, and very many other examples. Now, the COX-2 selective inhibitors have celecoxib, which is common one use, one you call Zicel. However, these other ones are rarely used because of their cardiac side effects. Now, the therapeutic uses of inflammation, of course, in brief, they are used in inflammation, because we are seeing that prostaglandins play a role in inflammation. So they are anti-inflammatory, not inflammation. Anti-inflammatory, I think, to be better. Anti-inflammatory, analgesics, because reducing pain, antipyresis, fever. Of course, aspirin in low doses reduces cardiac effect risk. Side effects, we have intestinal lesion, which of course can lead to ulcers, other abdominal pain, there are these ones, CNS, we have anxiety, hypersensitivity, and other side effects. Now, briefly, let me talk about other anti-inflammatories which we have in pharmacy. The common ones, of course, the other ones we have corticosteroids. Well, of course, these ones are produced in the middle zona fasciculata. Now, when I was talking about the adrenal cortex in the corticosteroids, we mentioned this. Of course, the hormone, the major one is cortisol. The synthetic ones, we have hydrocortisone. This one, of course, is a synthetic form of cortisol. Dexamethasone, prednisolone, betamethasone, beclomethasone, and budesonide, fluoxetine. Now, triamcinolone, of course, you know what triamcinolone is given. Triamcinolone can is used intra-articularly in arthritis. Can be used in arthritis. Now, which are those physiological effects of these NSAIDs? Of course, we have anti-inflammatory effects through the inhibition of the leukocyte function, and of course, that's why they use in rheumatoid arthritis. We have immunosuppressive effects. They inhibit cell-mediated immunological function, and of course, why they are used in allergy also, and the ocular diseases. Of course, they can affect protein and carbohydrate metabolism. That's why when you overuse corticosteroids, you get those bumps, those buffalo bumps. Of course, again, they're used in the bronchial asthma, inflammatory responses, and again, they're used also in organ transplant because they are immunosuppressive. I think here they're supposed to be used. Remember, this is the brief explanation of corticosteroids, but in case you can't get more information, you can contact us, we can help you. The side effects, I've said buffalo hump, due to redistribution of fat, weaknesses, moon face, and all these ones, increase susceptibility to other diseases. In the inhibitors of corticosteroids, we have looked at them already: ketoconazole, mipyronone, and mifepristone. So now I've looked at them somewhere, but you can pause and refer to them. Now, let me briefly talk about gout. Gout. Of course, gout is a common type of arthritis which causes pain and swelling and stiffness of joint, and usually affects the joint in the big toe. Of course, it's mainly due to uric acid accumulation in the joints. And of course, uric acid is secreted based on this enzyme xanthine oxidase, because most of the drugs we're going to look at will be inhibiting xanthine oxidase enzyme. You will be inhibiting xanthine oxidase enzyme. Yes, and of course, high uric levels in blood cause deposition of urate in joints and kidneys. And of course, when this one happens, they activate the macrophages and the immune response, and then the inflammatory factors come in. That's why we use also NSAIDs in management of gout. Now, of course, in the management option, we have a relief of inflammation, as said, prevent inflammation, inhibit uric formation, and augment urate excretion. Now, which agents are used? Of course, we have colchicine, which is extracted. This is a herb extracted from this plant, colchicum, otumare. It binds the tubulin and then prevent microtubule polymerization in leukocytes, hence reducing microfill recruitment. Of course, when this one, of course, is anti-inflammatory effects. Used in acute gout attacks and recurrent attacks. Side effects, mostly GIT. Allopurinol is a competitive inhibitor of xanthine oxidase, which converts xanthine to uric acid. And of course, it is used also in gout. Others, we have NSAIDs, which are used, of course, we have seen it above. Febezostatin, competitive inhibitor of xanthine oxidase, and then the uricosuric drugs. Of course, this decrease the reabsorption of uric acid in the proximal tubules, leading to increased excretion of uric acid. Examples, we have probenecid and sulfapyrazone, and of course the others, like which make urine more alkaline. Now, let us look at rheumatoid arthritis briefly. Again, this is an autoimmune disease which involve, of course, the joints. It's an autoimmune disease for these joints. Now, the drugs which are used here, we have in the NSAIDs, and of course the others, the disease-modifying antitraumatic drugs, the DMARDs such as methotrexate, sulfasalazine, and others, and also the T-modulating drugs. Now, you can contact us for more information. This has been a short presentation on all inflammation. I combined them such that at least you can aware. Though you can contact us, or you can read more in your handouts or in your notes. Thank you very much for watching and listening to me. I always remain Wilson from Information Training Solution. You can always contact us. We always reply. Leave a comment, like the video, and thank you very much.